So you're a little bit distal, right? Because I'm seeing lunate. So we just passed by scapholunate, right? So that first V, scapholunate. This is compartment number 4, extensor indicis proper, extensor digitorum communis. So work towards his head. Keep going, keep going, keep going. There we go. Now, not incorrect, not incorrect. This is ulna, this is radius, there was Lister's tubercle.
Yeah.
It's not incorrect, nothing wrong with it. That was the lateral side, this was the medial side. So we flipped it now. Lister's, compartment 2, 3, 4, 5, ulna. Distal radial ulnar joints, right? As long as you know which direction you're facing, it doesn't matter. It doesn't matter. But you have to know where you are, right? Calcific outgrowth, right? So bring it distal and bring it towards his thumb just a little bit. Keep coming. Yes. Coming down into here, coming back, coming down into here. That's gonna be our injection spot. Now, I'm gonna suggest you kind of get a little bit more of your hand down, get super settled. Because this is a very small finite injection. So the more access points you have down, the more controlled you're gonna feel. Now, I'm good with that shot. That's a great shot. That's exactly where I want to go, but it's a short porch, right?
Yeah.
It's gonna have to be super steep to get here. I'm not gonna send my needle for very much. So I'm gonna want to take this part and move it here. Keep coming a little further, 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 keep coming a little further. Now, I also got a little blinky in my way now. So I'm now gonna need to kind of adjust and see how I can get that out of my way. So it's gonna work a little lateral towards his thumb.
I think that's going to be our best access point. Take the probe. Oh, just a little bit. There, I like that access point better there.
So we're gonna go right over the top. Come down this way, right over the top into here, come back and lay it right here. We'll miss that completely.
So do a half cc. each
Half a
compartment.
cc in each spot, yeah.
Okay.
Okay, gonna get a little stick here, man. It's gonna go literally right underneath the probe. Now remember, this has distance, right? This is a 2-inch, right? So a full 2 inches across. So you have 1.5. So if I have to get all the way over here, I'm not gonna have enough, right? Right about, come over just a little bit, come back over, the other way, right there, right there. You're gonna be okay right there. Bless you. Yes, that's a great trajectory. Good, keep coming. I like how you're going nice and slow. So find yourself, yep, yep. It's a good adjustment. Good, keep coming. Keep coming. On that straight line. Uh-huh. Advance just a little further. You're there. Put a half cc right there. Flood down into here. So you can do one of two things. You can keep coming back and try to go a little steeper, or make sure that your bevel is facing down, and that's going to flood right down into there. Yeah, that's a great shot right there. Whenever you're ready, you can go ahead and inject right there. It'll float down. See it flooding in there?
Yeah.
We got a little across, but we got that much more big flood in there as well. There we go. And we're all out. Well done. Like that.
Nice job.
Hey, nice job. Everybody give him a clap.
Yeah.